Welcome to the deep dive. You asked, we listened, and today we're really getting into managing diabetes mellitus DM in dogs and cats.
Mm-hmm.
You gave us a great list of resources, and well, our mission is to pull out the most crucial bits, the interesting stuff, so you get a solid understanding quickly without drowning in info.
Exactly. We want to cut through the noise. We've looked at the 2018 AAHA Diabetes Guidelines, PetMD, Veterinary Partner on DKA, a really interesting PMC study on cats,
Oh yeah, that one.
Pet Diabetes Month resources, and another PMC piece on insulin updates like pens. Quite a mix.
It is.
So yeah, we're aiming to give you the current thinking, the important considerations for helping your diabetic pets.
Okay, great. So let's start, well, at the start. Diagnosis. How do vets figure out a dog might have diabetes? PetMD had some pointers. It's not just high sugar, is it?
No, not just that, though. Persistent high blood and urine glucose are, key signs.
Oh.
But PetMD mentions a wider workup. Vets often start with standard bloods chemistry, CBC, and a urinalysis, looking for glucose, ketones, other clues.
Right, the basics. And what else might they check?
Well, a fructosamine test gives an average sugar level over the last, say, 2 or 3 weeks in dogs, maybe 1 to 2 in cats. Imaging like x-rays or an abdominal ultrasound might come into play too.
Okay.
And sometimes, specific blood tests, thyroid checks, tests to rule out Cushing's, or even check for pancreatitis, because these things can sometimes complicate diabetes or even be linked.
Sounds pretty thorough. A real detective job.
It can be.
So once you have that diagnosis, what's the general game plan for treatment? Insulin seems like the big one.
It really is central, and the AAHA guidelines draw a pretty clear line, initially anyway, between dogs and cats. For dogs with clinical DM, they always need external insulin. Their bodies just aren't making enough or using it right.
Always for dogs.
Okay.
But cats, they can sometimes go into remission, maybe not need insulin forever.
That's a super important point, yeah. For cats, the starting point is often diet plus insulin. And yes, remission is a real possibility. It's where the cat might, stop needing insulin injections. Both AHA and that PMC study mention it. The rates vary a lot, though, maybe 15% up to, some studies even say 100%, though that seems high for most cases.
What makes a difference?
Good question. The PMC study suggested things like diet type. We'll get into that, how early it's caught, the cat's health overall. It really hammers home how important early diagnosis and getting the diet right can be. Definitely something to talk to your vet about early on.
Remission? That's fantastic news for cat owners, potentially.
Yeah.
Now, the insulin itself, are there specific ones that are, officially approved for pets?
Yes. The AHA guidelines are clear here. Only 2 insulin products are FDA approved for both dogs and cats.
Okay.
That's Porcine Lente. Most people know it as Vetselin, and recombinant human protamine zinc insulin, PZI, which is often sold as Prozinc.
Vetselin and Prozinc. Got it. But what about others I might hear about, like Lantus or NPH?
Yeah, those get used a lot too, but technically they're off-label, meaning not specifically FDA approved for pets. So Glargine, that's Lantus and Detamir, or Levemir, they're often used in cats. NPH, like Humulin N or Novolin N, you see that more in dogs sometimes.
Right.
Oh, and the guidelines generally advise against using compounded insulins. Concerns about consistency,
Makes sense.
And they also don't typically recommend diluting insulin either. Can affect stability and how it works.
Reliability is key, I guess.
Yeah.
So how does the vet figure out the right dose? It can't be the same for every pet.
Definitely not. AAHA says dosages should be based on the pet's estimated ideal body weight, not necessarily current weight if they're over or underweight.
Ideal weight. Okay.
And they recommend starting low, going slow. Adjustments usually no more often than every 1 to 2 weeks. Gives you time to see the response.
Patience is needed then.
Absolutely. And remember, how long an insulin lasts, when it peaks, the pharmacokinetics that varies, depends on the insulin type, the formulation, and just the individual dog or cat. Everyone's a bit different.
So very personalized. What about timing? Does it have to be bang on the same time every day?
Consistency is good, for sure. But AAHA acknowledges some flexibility is okay, like maybe a 2-hour window around the usual injection time is generally acceptable.
That's helpful for real life.
It is, and interestingly, and none of the insulins we use are actually dog or cat specific in their structure, but thankfully, developing antibodies against the insulin doesn't usually cause major clinical issues.
That's reassuring. One last general insulin question. How long does a vial last once you open it?
Well, the manufacturers usually say discard after 4 to 6 weeks or by the expiry date.
Okay.
But the AAHA task force felt that if you handle it really carefully, keep it refrigerated, don't contaminate it, you might be able to use it for up to, say, 3 to 6 months if it still looks completely normal. No cloudiness, no color change, nothing weird.
Good to know.
But if you see any change, toss it. And if your pet's control suddenly gets worse after a few months on the same vial, maybe try a new one, even if it looks okay.
Right, makes sense. Practical advice. Okay, let's dig into some specific insulin types. AHA and the PMC update gave details. Vetselin, the porcine lente one, it's approved for both.
Yep, porcine lente, Vetselin, it's intermediate acting. AHA says in cats, the peak effect, the nadir, is usually 2 to 8 hours after the shot, lasts maybe 8 to 14 hours.
And dogs.
Dogs are a bit more variable. Peak can be anywhere from 1 to 10 hours, and it might last 10 to 24 hours. It's a U40 concentration that's important for syringes, and it comes in pens, too, for both.
Pens, okay.
And the really key thing with Vetselin, you have to gently shake the vial before drawing it up. It's a suspension. The manufacturer actually suggests starting dogs at 0.5 units per kilo once a day.
Shake Vetselin, got it. What about Glargine? Lantus, you said that's common in cats.
Glargine, right. Long-acting, not FDA approved for pets, remember. In cats, peak effect is often later, maybe 12 to 14 hours, and it can last 12 to 24 hours.
Longer lasting.
Yeah. Dogs, the peak might be a bit earlier, 6 to 10 hours, similar duration. It comes in U100 and U300 concentrations, but very important. Only use the U100 in pets. It's definitely a go-to for many vets treating cats.
U100 only. Okay. And the other dual approved one, PZI, Prozinc.
PZI, yeah. Also long-acting, FDA approved for both. AAHA puts the cat nadir around 5 to 7 hours, duration 8 to 24. Dogs' peak is maybe later, 8 to 12 hours, also U40 concentration.
So similar duration potential to Glargine.
Can be,
Yeah.
yeah. Popular for cats, used a bit less often, maybe as a first choice in dogs, but there's now FDA approval for once daily dosing in dogs, which is newish. Some vets might still start twice daily at a lower dose, though.
Interesting how the timings differ. What about NPH Novolin or Humulin?
NPH, intermediate acting human insulin, not FDA approved for pets. In dogs, the peak is super variable, could be 30 minutes, could be over 8 hours, duration is shorter, maybe 4 to 10 hours.
Shorter acting then.
Generally, yeah. It's U100. It's an option for some dogs, especially bigger ones perhaps, but rarely used in cats because it just doesn't last long enough for them usually.
Okay. And the last one mentioned was Datamir, Levemir.
Datamir, right. Another long-acting human one, not FDA approved. Cats peak around 12-14 hours, last 12-24. U100. The key thing here is it's known to be very potent in dogs, so you have to be cautious.
Potent in dogs, okay.
It can be useful, though, if MPH or Vetselin aren't lasting long enough in a particular dog.
This is a great rundown, thanks. Now that PMC update mentioned insulin pens. Seems like they could make life easier for owners.
They definitely have potential benefits, yeah. The update suggested they can make measuring and giving the insulin simpler, maybe less painful for the pet, possibly more accurate dosing, too.
Accuracy is good.
And there's even one called the Vet Pen, specifically for Vetselin or Caninsulin as it's known elsewhere.
A dedicated pet pen, cool. Are there others can use human pens?
Yeah, the article mentions some human pediatric reusable pens like HumaPen Luxura HD, NovoPen 3 Demi can be used if you get the right insulin cartridges for them.
Ah.
A big plus for those is they often dose in half-unit increments. Really helpful for tiny doses in cats or small dogs.
Half units, wow. So if someone uses a pen, what are the crucial how-to points?
Storage and technique are key. Always use a fresh needle for every single injection. Sterility, comfort.
Makes sense.
Before injecting, you need to prime the pen, do an air shot. Gets rid of bubbles, ensures it's working right.
Priming, okay.
Hold it in place during the injection for the recommended count. Make sure the full dose goes in. Store the pen without a needle attached, usually refrigerated once in use, but check the specific insulin's instructions.
Right. Is the injection technique itself different from a syringe?
A bit, yeah. For pets, subcutaneous injection, the article generally recommends slightly longer needles, maybe 10 to 12.7 millimeters to make sure it gets under the skin properly.
Longer needles.
And if it's a suspension insulin, like Vetselin, you still need to mix it well before using the pen rolling and inverting gently. And again, that priming or air shot is vital every time.
I bet some owners feel nervous about injections. Do pens help with that?
Often, yes. The update noted many owners are kind of used to pen devices for other things, maybe. They find them less scary than syringes. feel more confident.
That's a big deal.
Yeah, and maybe more willing to let others help give the shots. Plus, the potential for better accuracy and less risk of accidental overdose gives a lot of peace of mind.
Sounds really positive overall. Okay, moving beyond insulin for a moment. Are there other meds used for diabetes?
The AAHA guidelines mention a couple. Sulfonylureas, like glipizide, they can help cats' bodies release more insulin, but they don't really work in dogs.
Cats only then?
Pretty much. And really only considered if owners absolutely refuse insulin. And you have to monitor liver function closely if you use them.
Okay. Anything else?
There are alpha-glucosidase inhibitors, like acarbose. They slow down sugar absorption from the gut, can help reduce sugar spikes after meals.
How are they used?
In cats, sometimes with insulin and a low-carb diet. In dogs, maybe with insulin. But diarrhea can be a side effect. And they're rarely strong enough on their own, especially for dogs.
So insulin really remains the main player.
In most cases, yes.
Let's shift to diet then. I know you mentioned it's important especially for cats.
Absolutely critical. AAHA, PMC, PetMD, they all stress diet is essential co-therapy for both dogs and cats.
And for cats, that low-carb approach.
Yes. The evidence, particularly from that PMC study, is pretty compelling. High-protein, low-carbohydrate diets seem to significantly boost the chance of remission in cats, especially when paired with insulin.
That's huge. Did the study favor specific types of low-carb diets?
Interestingly, yeah. It found that commercially available wet food diets were linked with higher rates of remission and also remission without relapse later on.
Wet food specifically.
Yeah. And AAHA also notes that changing the diet can change how the insulin works, so you need careful initial insulin dosing when you make that switch.
Diet sounds like a powerful tool, especially for cats. Okay, so you've got the insulin, the diet. How do you know if it's actually working? How is it monitored?
The main goal, AAHA says, is getting rid of the clinical signs, the excessive drinking, peeing, hunger stopping, unintentional weight loss, and crucially, avoiding hypoglycemia, that dangerous low blood sugar.
Right. And what are the best tools for tracking that?
Blood glucose curves, BGCs, are much better than just spot checks. You get the whole picture of how sugar levels change over the day.
Curves, okay.
And strongly pushes for doing these at home, especially for cats. Clinic stress can really spike their sugar levels artificially. Stress hyperglycemia, they call it.
Home testing. How do owners actually do that? Get the blood sample?
The guidelines list a few spots. The edge of the ear is common, gums, maybe non-weight-bearing parts of foot pads, or an elbow callus.
Okay.
If using a human meter, you might need a lancing device you can adjust, or even just a fine-gauge needle to get a tiny drop, like from the ear vein.
Wait.
Takes practice, patience.
I can imagine. What if home blood testing just isn't going to work for someone?
Urine glucose monitoring is an option. Less invasive, but less informative too. Ideally, urine glucose stays low, like negative to maybe 100 milli-GDO. If it's consistently higher, that's a flag to maybe check blood sugar or talk about insulin adjustments.
Okay, so urine is a backup? Kind of?
Sort of. There are also continuous glucose monitors like the Freestyle Libre. Those can be really helpful for catching hidden lows or big swings day to day.
That's the ones people use.
Similar tech, yeah. Adapted for pets. And finally, fructosamine, that average measure over weeks can give a general sense of control, but again, doesn't show the daily fluctuations.
Lots of monitoring options then. Based on that monitoring, how are insulin doses actually adjusted? Are there rules of thumb?
AAHA gives general guidelines, yeah, based on the nadir, that lowest glucose reading, and the clinical signs. But they stress small, conservative changes.
The small steps.
Exactly. And always consider the individual pet. Critically, if you see hypoglycemia even just once on a curve, the dose must be reduced. No question.
Safety first.
Absolutely. Though, interestingly, they also point out that super tight glucose control isn't usually the primary goal in pets like it is in people. Good control, yes, but avoiding lows is paramount. Especially in older pets. Need closer watch, maybe?
That's a useful perspective. Now, what if things aren't going well? The diabetes seems uncontrolled despite treatment. What's the troubleshooting process?
AHA has a great checklist for this. First step, rule out owner and insulin issues. Are they giving the shots right, using the right syringes for U40 or U100? Is the insulin okay expired? Cloudy when it shouldn't be, stored correctly.
Back to basics first.
Always. Then review the diet again. Is the weight loss plan working, if needed? And look at all other medications. Steroids are a big one. Pills, injections, even sometimes eye or ear drops or skin creams the owner uses that the pet gets exposed to.
Wow, even topical stuff.
Can happen, yeah. Also, drugs like cyclosporine, some hormone treatments, they can all cause insulin resistance.
As long as you might not immediately connect. Okay, if all that checks out.
Then it's usually back to the vet for more tests. Repeat baseline blood work, urinalysis, maybe check blood pressure, urine protein, and then potentially second-level diagnostics.
Looking for what?
Underlying problems causing insulin resistance. Things like chronic kidney disease, pancreatitis, hidden infections like UTIs, even cancer or other hormone issues like Cushing's, acromegaly in cats, thyroid problems.
So could be something else entirely making the diabetes hard to manage.
It could, yeah. Needs investigating.
Which brings us back to the pet owner. We touched on it, but how crucial is client education in all this? AHA seemed to really stress it.
It's absolutely paramount. Can't manage this without the owner being fully on board and knowledgeable. They need to understand how insulin works, how to give it right, store it right, shake vessel in, roll others gently.
The specifics matter.
Hugely. Use the correct syringe, U40 for U40 insulin, U100 for U100. Mixing those up is dangerous.
Reducing errors possible there.
Exactly. They need proper injection technique demonstrated, single-use syringes, right needle length, clear instructions on what to do if the pet skips a meal or vomits, how to spot signs of low and high blood sugar.
Recognizing the signs.
And the importance of sticking to the diet, managing weight, providing written info helps. Pointing them to good online resources like AAHA's site or Pet Diabetes Month.
Support materials.
Yes, and just offering encouragement. It can feel overwhelming at first, letting owners know that success is possible. It just takes time and teamwork with the vet that makes a huge difference.
That support sounds vital. Now, one of the sources, Veterinary Partner, talked about a really scary complication. Diabetic ketoacidosis, DKA. What is that exactly?
Yeah, DKA is a true metabolic emergency. It happens when there's a severe lack of insulin. The body gets desperate for energy and starts breaking down fat like crazy.
Oh, okay.
This breakdown produces ketones, which are acidic. They build up, mess up the body's pH balance, cause massive electrolyte problems, severe dehydration. It's a metabolic disaster, basically.
So way beyond just high sugar. It's a whole body crisis.
Absolutely. Much more critical. If a diabetic pet gets really sick, lethargic, vomiting, and has ketones, they need immediate, aggressive hospital treatment. Often 24-hour care, maybe referral to an emergency or specialty hospital.
Definitely something owners need to know about, that potential for severe crisis. Let's circle back to that PMC study on cats' survival, remission, quality of life. It had some really specific findings, didn't it?
It really did. They found a 29% remission rate in the treated cats in their study group.
Nearly a third. That's significant.
And again, that strong link between feeding a commercial wet diet and achieving remission and staying in remission.
Really hammers home the wet food point for cats. What else stood out?
Well, achieving remission was clearly linked to better quality of life for the cat. Owners of cats in remission worried less about limitations on the cat's life.
Makes sense.
Interestingly, surviving the initial period, like the first 4 weeks, was linked to owners reporting lifestyle limits and worries, but also feeling the cat's quality of life wasn't badly affected suggests maybe very dedicated owners got them through that tough start.
Ah, the owner's dedication.
Yeah. Longer survival overall was tied to better quality of life and less owner worry about giving meds. And insulin treatment itself was linked to longer survival, especially if started in younger cats. Remission, staying in remission, clearly associated with better quality of life.
So remission is a huge win for the cat's well-being and the owner's stress levels.
Definitely. The study also confirmed owner challenges, limits on their daily life, worry about complications. It really underlines why that client education and support we talked about is so key.
This has been incredibly thorough. We've covered diagnosis, insulin types, pens, diet, monitoring, troubleshooting, owner support, DKA, the cat study.
Wow.
Okay, boiling it all down, what are the absolute key takeaways for our listeners?
I'd say. 1, diabetes management is highly individual, needs a plan tailored to that pet. 2, insulin is usually the core treatment, but diet is critical, especially high-protein, low-carb wet food for cats, which seriously boosts remission chances.
Right.
3, monitoring is non-negotiable. Home blood glucose curves are ideal. 4, avoid hypoglycemia, that's paramount. And 5, client education and support are everything. Success depends on the owner feeling confident and supported.
It's a partnership.
Totally.
And, thinking about those insulin pens becoming more common, easier to use, and that strong diet link for cat remission, it makes you wonder, what's next? What further tweaks or personalized approaches might we see for managing pet diabetes? It feels like there's constant progress.
That's a great point. How do we continue to refine things? Better monitoring tech, even more tailored diets. It's about finding that sweet spot optimal medical management while ensuring the best possible quality of life, not just for the pet, but for the person caring for them too.
Finding that balance, a really important thought to end on. If you want to dig deeper into any of this, check out the sources we mentioned, but most importantly, talk to your own vet about what's right for your specific dog or cat.
Absolutely. Thanks for joining us for this deep dive.